The Kenya National Commission on Human Rights is concerned with the reports emanating from Pumwani Maternity Hospital, where 11 bodies of infants were allegedly packaged and hidden in polythene bags and boxes. These bodies were discovered yesterday, as I said, through what we could call a sting operation by the governor of Nairobi, a stint operation by the governor of Nairobi, Mike Mbuvi Sonko. This discovery points to gross violations of human rights and calls for serious accountability on anyone who could have been behind these violations. The Pumwani Maternity Hospital issue brings to the fore the systemic challenges in delivery of quality maternal health care services across this country. So although we saw this only in Pumwani, we've had reports from Bungoma in the past, we've had reports from other places, and this just points to a serious systemic issue insofar as the delivery of quality maternal health care is concerned in this country. We are concerned that despite the free maternity policy in place in Kenya, women in this country continue to experience poor quality maternal care services, including abuse and neglect of expectant mothers. These cases have been reported to us. There is also the issue of lack of adequate infrastructure and personnel in health facilities, and we continue to receive cases of detention of mothers for inability to pay various maternal care fees that have been charged by different hospitals. In addition, we as a commission participated with the Ministry of Health to develop norms and standards that should guide the provision of healthcare in this country. Those norms and standards were adopted as a policy in 2017, and we expect that they should provide a framework for the delivery of health services in this country. Ladies and gentlemen, we all know that the right to life is sacrosanct. The right to respect and protect the inherent dignity and the right to the highest attainable standard of health, including the right to reproductive health care, are key constitutional guarantees provided for under Article 26, Article 28, and Article 23 of our Constitution. The cause of death of these infants and the manner of disposal of the said bodies must be properly and administratively documented and accounted for. As I said earlier, we've had the response from the medical personnel, from the management of the facility, but as a commission, we say that still more needs to be done beyond the public statements that they have made, assuring us that accountability will be pursued. In this regard, we as a commission, on our own volition, of course, based on our mandate, we have put in place a motion that will help us start independent investigations into this matter to ascertain whether or not the serious human rights violations that appear to have been committed, when they happened, who committed them, who is culpable, who is responsible, and what needs to be done. In fact, this afternoon, as part of that process, we've been in contact with the office of the governor of the Nairobi County, Governor Mike Sonko, and he assured us that he's going to give us all the necessary cooperation. We'll expect the same from the management of Pumwani Medical Facility because, as I said earlier, this is a matter that has to be addressed holistically. It shouldn't be a touch and go. Our plan is to go out there, conduct investigations, do an audit, and really find out where the problem is. It's on the same breath that we call upon the Inspector General of Police to immediate, and also the ODPP to institute investigations with a view to holding any negligent persons accountable for acts of criminal omission or commission. We also call upon the Public Service Commission to immediately begin the recruitment process for the appointment of the Coroner General under the National Coroners Services Act, because we think these deaths are suspect, and having in place the Coroner General would really have been very useful in helping us to do independent postmortems to verify how these infants met their deaths. This appointment of the National Coroner will facilitate public accountability, immediate reporting, and investigations, even in cases of infanticide, as captured in Section 28(1) of our Penal Code. Finally, ladies and gentlemen, we want to take this opportunity to call upon all Kenyans, to call upon the mothers and any other members of the public with relevant information to share their statements or complain with the National Commission. We are asking them to contact our head office. We are located at the CVS Plaza, Nairobi, Kilimani area, Kasuku Road, off Lenana Road, and they can visit our desk at Huduma Center. We have a Huduma Center in Makadara, which is in Makadara, Nairobi, opposite the former DC's office. Or they can also call us on a toll-free cell phone number, which is 0724-256-448. Another number is 0733-780-000, or send us an SMS again, which will not be charged to our SMS number, which is 22359. We will respond to all who reach out to us in confidence. As I said earlier on, our intention is to ensure that the health provision in this country is done in line with the law, and that even when all these policies that are the good policies that we have in place will not mean anything to us if the healthcare providers are not willing to abide by them. Another thing that we got to know from the governor this afternoon is that the county has allocated 6.7 billion in this financial year to the healthcare sector. We hope that this money is going to be prudently used to improve the overall healthcare system in Nairobi, and particularly the maternal healthcare, to complement what the national government has done under Linda Mama and other similar programs. We thank you for giving us this opportunity.